Our mind works in a very mysterious way. I have built more than 100 websites till now. And the science behind a great website design. Stage 1, unaware. Stage 2, a researcher. Stage 3, an evaluator. Stage 4 is a purchaser who is going to take appropriate action. Live website, what we have designed, have more traction. The more people will come to your website and actually take action on your website to get a solution from you. Structure all the 15 sections in this particular template, which I'm going to give you for free. Let's jump into that. Hello healthcare professionals, Dr. Sajjan here, digital health consultant, and today we're going to have an amazing mind-boggling topic, that is website design flow strategy. You see, our mind works in a very mysterious way, but when it comes to finding a solution to a particular problem, it works very strategically to solve that problem. It could be your patients, it could be your any consumers who's looking for a solution which you're providing. They're going to go through a strategically flow to actually make a decision to take a solution from you or not. And that's where the website and the structure of the entire website content makes a very important step in the entire design of a website. And so we're going to look into the today's topic, that is website design flow strategy, right? So in this website design flow strategy is actually what you're going to do is we're going to understand the science. Basically, yes, that's correct. We're going to understand the science behind a great website design actually gets you results, right? The website is not just to showcase what you're doing and just have one website and leave it off. There is a science behind how the design workflow goes based on how your consumer thinks, and that's what we're going to demystify today. Let's dive into more details, and before we go into the entire structure, I'm going to give you at the end of this entire video a wonderful free gift. It's going to be a free gift where you're going to get an entire template, the scientifically structured website content design template for yourself as a Word document, so they can edit and change and add more content to it, so that your website becomes a very structured way of how you can build that up. Okay, so just watch till the end and you're gonna get an amazing free resource, which what we discussed, we're gonna add that and give a ready-made template so that you can use it in the process of getting your website in a flow. Okay, right. So now let's go to the entire process. So in the last video, we looked into an physical infrastructure, right? How to build a physical infrastructure, and we compared on how to build an digital infrastructure, right? So this is what we discussed in the previous video, how the digital infrastructure, that's a website. So we looked into the 7 essential website terminologies that every healthcare professional should understand, so that they can make an informed decision and get the understanding of it. Right? If you missed this video, I think I'll put somewhere on the top. It would appear now. You can click, or you can see in the description for the previous video before you watch this video. You want to go in the flow. Okay, right. So that's what we discussed, the physical infrastructure, and we compared it to a digital infrastructure because to create the relatedness in understanding, right? So in the same way, so what's a website? A website is a digital presence of your practice. Okay, or clinic, hospital, diagnostic center, lab, whatever it is, it's a digital presence of the physical infrastructure, right? So if you're looking to have your own physical infrastructure, which you already have, I believe, right? What we're going to do is we're basically trying to convert the physical infrastructure as a digital infrastructure where people can come online and find a solution for their problems. Right? And it could be a hybrid model where they come to an online portal to come to an offline consultation, right? So when it comes to digital infrastructure, so there is a strategy behind how you structure on the top of the website, middle of the website, and the further and the bottom of the website, right? So that's what we're going to look into, how the entire digital infrastructure you can create from the strategy point of view. Okay, so let's dive into the structure. So what I call for this is called as purposeful user flow journey. It's purposefully built in such way so that you understand the strategy of your consumer's brain, how it works. It's not only consumers, even my and your brain works in the same way. If you have to take any decision on getting a solution from any particular place, right? The same thing which you're going to apply, and that's what we're going to discuss now in the further slide, which would be very amazing, mind boggling, which I think you can all relate to, right? Let's jump into that. Okay, so now the how that entire process. So someone comes to your website, so that's a visitor coming to your website. Then they come to your website. So this funnel which you can see looks like it's a part of your website. In that website, now they go from the top to the bottom, right? So we have I've given the 4 rings there. So we have 4 steps: step 1, 2, 3 and 4, right? There are 4. They go through 4 steps, and that is the strategy what we're going to explain further. And once they go through the 4 step, they are sure to take a decision on should they take a solution from you or not, right? Is it the right person who are they finding the solution for? So that's what all we want by having a website, to give the authentic information to the public to see if we can solve their problems, right? So that's what is it. So with that, what is that strategy? What is that mind-boggling methodology, how we can get this structure in place, right? So let's work into that. The stage 1 is anyone who is coming to your website or online space, he is unaware of who you are, right? And at that point is where I think I'll put my video to the center as of now. So that's where you give your positioning on the top of your website. So what you meant by positioning is basically on the top of your website, where you can show what you practice, what's your core specialty, and what is your area of work, so that he can understand who you are, right? And is it the right place I'm getting the solution from, right? So the second stage, once that's clear on is it the right person, is it the right place where I'm in that particular, for example, diabetes. Let's take diabetes as a problem. So you have mentioned you're specialized in diabetes, or you're actually doing the diabetes care, right? So when it comes to diabetes, he's very specifically looking into diabetic foot care. So he's having some problem with the foot, and he wants specifically, that's where you have to put your services and things, right? Now in the second space, where it becomes a researcher, now he wants to know more about this particular problem, the solution of that problem, and that he wants to research more about that particular thing. And that's where you tell your services in brief, giving them information. Yes, diabetic foot care is part of our service. Please, yes, we resolve these problems. And that's where your basic infrastructure of services is detailed, and give them the information on the research things what they want. Okay. And the next thing what we have is they become an evaluator. Now he wants to evaluate to know what is your experience and what are the results you have got in this particular area. So that's where he becomes a researcher, to understand more credibility about you, and more feedbacks, or what are the achievements you have done. Okay, that's where the case studies will come in place, and that is the third part of the website. And finally, once they are in the final stage, because once they started evaluation, now they're ready to so book an appointment from your platform, right? So they want to get a consultation from you, and that's where call to action, that is the last part. You have to tell them how they can get your service, right? Either get an online appointment, online consultation itself, or online appointment with an offline consultation, or a phone call the phone number to get an appointment. All these things has to be very clearly mentioned in your platform, so that they can take appropriate action, right? So this is what is, we call it as a purposeful user flow journey. Okay, very structured way of how the user can flow through, so that they can take an action, which is all what we want to give solution to the problems what they have, right? So that's what we are looking into here, right? So let's go more detailed into this particular structure. The first thing is the stage is unaware, where person is not aware of what you are providing, for which you're going to have a big hero section, we call it as header, where you mention what you do basically in a one line statement. Okay, and then further after the hero section, the next section would be service icons. Very briefly tell them the different areas or verticals you are giving solution to. Okay, so if it is a diabetes practice, so you can have a diabetic care and diagnosis also you do, lab also you do, medications reversal, diabetic foot care, all these things can be part of your headings. Okay, for an example. Right. So that is a service. So at that point, he's sure that, okay, you're giving all the services here and that's the right place for me to go. Next, now at the unaware section, he's not aware of who you are. So give some information about any affiliations and credibility to build at this particular point so that he can get more confidence to take the things further to understand better. Okay, so that's what we are going to do in the stage one. We have 3 sections, right? And in stage 2, the person becomes a researcher to research what you have to provide in your website, right? As a researcher, he wants to understand more details of service, because in the top we are going to only one point names of services rather than details. So details of these services are provided in the further down in the website, where it becomes to research more for them. And once you give them more research, now you can give them more case studies and by writing blogs. So in the previous video we discussed that blogs are what? Blogs are staff which you are actually hiring to run your in the physical infrastructure. There is staff. When it comes to digital infrastructures, blogs are like staffs who are going to working for you 24/7, 365 days to provide information to people when they come to your platform, right? So that's where the blogs are very important, and you need to put some case studies, success stories, discussion with the higher consultants, different cross department informations can be added, and all these things will actually show your authority in the particular subject of what they want the solution on, right? So that's what the blogs. And once you understand, okay, you have the authority in that particular area, and yes, you are providing these services in detail. Now he wants to evaluate your practice and your services, right? At this point, give them the testimonials telling that what other people who have benefited from your solution has to be established at this point of time. And you also give you more detail at this point of time. You start introducing yourself and give more detailed to about your practice and things. Then you can also add a lead magnet, which is specifically either you give a free video or on something which you want to give more details about. For example, a diabetic foot care, you make around half an hour to 1 hour video on how a person can do a self foot care of his problems and how to maintain it, and give them as a free thing where you can collect phone number and email ID and details of the particular consumer, so that you can give more solutions to them later on. Okay, so that's what happens in the evaluation phase, where you can give more information. So it could be a video, it could be a PDF, ebook. All those can be given as a free thing in exchange to their details. Okay, at the final space, now he is ready to pay an amount to get your service, right? And so at this point, what has to be there on your platform? So as a final stage, as a purchaser, what he wants to know is, yes, I am now ready to take your service. What should I do? Right? So at this point, you need to specifically tell them more about either book the online appointment, offline appointment, or give a call. So very specifically, it has to be highlighted. That's called as call to action. Then if you're having some services which you can display as a pricing on the platform, it's again, if you can, right? It's not mandatory, but if there are products or any other things which can be displayed as a pricing, yes, that would be a great thing. And please provide all the contact details so that they're confident that you are a legitimate person and you're ready to give the contact details of your the reception so that they can contact them. Then you have also add frequently asked questions. So now being in a practice for whatever time you are in, you know what most common questions people come up with. So instead of answering that every time on the phone or things, people are now more of self-service minded, so they will actually they can serve themselves by understanding those frequently asked questions. So that's a very important thing, so that once their basic questions are answered, they will come back and take a action on either book an appointment or consulting you, right? So that's what is going to happen. So finally, you have the last one. If they want any come to your practice as a physical infrastructure, then Google Map location is one of the main thing which has to be there, so that they can easily navigate to your practice area. Okay, so these are the areas on how you have to be structured in your website. Okay, so there are some more additional supportive elements which you can add in your website to enhance the design and the visual cues there. So you can have some creative highlight banners highlighting some of the areas of your practice, and have a detailed footer, so that at the end of he comes to the end of the website, the bottom part of the footer part of the website will actually give them more information which is already clear, so they can click the links and go to that particular relevant section and read it again if they have some more contributions, right? So this what is the specifically what I called as design flow strategy, which is around 15 sections. Each part what we discussed is a section, so we have 8 here and total 15 sections. So this 15 sections, if you can strategically structured in your website design, it will create a great impact in terms of people, consumers who are gonna come and actually take action to get a consultation with you, because whatever the way how the brain works for a consumer is already answered from unaware to be an researcher, to be an evaluator, and to finally take an action as a purchaser, right? So that is what is it. Further, what we'll be discussing is this is more of theoretically. I just showed you how the design has to be. So let me just give you an live website, how what we have designed. What we have designed for consultants, one consultant and one academician. So I'll show you both one health coach and one specialist website, what we have designed and how the structure has gone as per the science behind creating this design. Okay, so let's now navigate to Google and see how the design would look, and let me explain you that particular structure what we designed. Okay, so let's move to the Google now. Right. So now the first website I would like to show is about Dr. Ravichandran. Okay, so let's go through the entire flow and you'll be able to understand it better as we go. So as what is the first stage is unaware. So you are unaware about his practice now, right? So as you come here, so if you can read the title, what he's telling, experience the cutting edge urology care. Meet the uro-oncologist and robotic surgeon. So you know at this point you are clear that if you actually searched for some kidney problem, right, a kidney cancer or kidney problems, and now you landed here, and when he's talking about uro-oncologist, so you know that he's talking about he's more specialized in cancer on urology, right? So now he wants to know, does he actually work on kidney or it's only on very specific areas? So you just scroll down and he will understand what all areas does he has his expertise and gives his solution to. So that's where you can look into prostate cancer, kidney cancer, bladder cancer, and these are things. And now you know that solution to the problem which you wanted. You know that, okay, at this point of time, he's a neurologist. Great. Now he's providing solution to kidney cancer. Great. So that's what I wanted to know. So now you are actually unaware. Now you got awareness. Now you becomes an researcher. Right now you want to research more into this particular problem. So now if I can click, it directly jumps to there. For example, let me just scroll it down. So some highlights. So before he goes, he's still unaware. So what we did, we gave some information of Dr. Ravichandran here and his some degrees and his surgical experience. So now he's we have built a credibility here, and is also affiliation with organization nationally and internationally. So now you already built a credibility of yourself in this particular section. So by now, Don't you think a person who is unaware about a particular doctor comes to a particular website searching for a particular solution, and he finds that yes, this doctor is providing that solution, and he is having those credibilities. Now he's more interested to understand things better, right? So that's how the your mind works. So now he is still in the researching phase. So now in this research, so he knows that, so now again, now question for you, instead of he asking question, now at this point you only ask a question to him telling that why choose us, right? Give some information. You tell we are a patient centered practicing area and what we do there. And at this point, if he's already made a decision, you just give them information on how to book an appointment. Just click that book an appointment, right? So if he's still not, he's still evaluating, give them more information on services, like now is an evaluation, prostate cancer details, so kidney cancer, this is the basic information, what is it, and other problems you can just see how you can see. So at this point again, if he is ready, he can now take action. Now still he is not ready, he did a research but still he's not clicking on the button book appointment. Now he becomes an evaluator. Now he want to evaluate to understand more. Now I understand you are specialized in that area, you have that area details and you're giving solutions. Now I want to evaluate, do you have an authority and what results have you got in this area, so that I can take the solution from you, for which you show your authority by showcasing some blogs, the contents and some stories from patients in these areas, success stories and interactions you can put. Great, because that's where your staff, right? Blogs are staffs which actually adding value to you and your consumer, so that I can take a decision. Okay, then you talk about, you can also give some achievements, what you've done, honors, presentation, works, what are research areas which you worked on. Now at this point, yes, I want to know what solutions have you got, or to the patients, for your patients, and what are the success stories. So give them some testimonials on what people are telling about your practice and your care, right? So that's what he, now at this point, now he has some more, basically here now he is doing an evaluation. As much as possible, give him an reason, he wants a reason why he should contact you for the care. So that's where we are building that entire structure, giving them the information on, for him to evaluate why he is to come to you for the services. And now he's confident to take action, right? So being an unaware, he became aware of you and your specialty. He became he researched about your work, he evaluated your work, and he got some testimonials and feedbacks, understood. So he is at this phase that he wants to now get an consultation from you. So at this point, you need to clearly inform them how he can get an appointment, through an WhatsApp, through an email, through an call, right? So you can just book an appointment and get consultation from you for your practice. And we also have booking appointment system. And then if he wants to come further booking appointment, he also wants to know which location you're working in, right? So this give them the information of your location, and that's where now you're given the entire details and further details in the footer, where you can go back to the home and get the details of further, you want to read it again, you get all the information, right? So this is how you make the entire structure in one phase, and that's how you can strategically build this entire flow. And each button is clickable. If for example cervical cancer, if you just click on it, goes to the testicular cancer and gives you more details, right? So that's how you build the entire structure strategically as a flow, right? So let me give one more example. It's again example of our own website on the, if you're a health coach, or if you're building an online academy, how do you build the structure, right? So you can see that this is a header which shows what all different areas we are doing. So I'll just little jump faster and give some more highlights, and what are the categories of areas where you can get your training, skill training on. and some popular courses of what people are doing. So as I've written, I'm an author of ECG book, so we have done a lot of ECG training programs, so that's where it's available and people can come and take them. And digital health and other courses, these are some popular courses. We have more than 1 lakh plus healthcare professionals, so basically building an authority in the area and telling that so many people are part of our training program, so that it builds more credibility and confidence in the students or anyone who is consumers, right? And you talk about who you are and what's your credibility to give this particular training and give that information. And then you tell what are the success stories, give some testimonials written, some video testimonials from the doctors and healthcare professionals who have taken your training programs. And to now, not everyone would like to jump directly, so some freebies. For example, in this case, we are giving a free easy skill blueprint training program, which is around 1 hour, so where they can come and join and basically understand and then actually take an action. So this is called as the lead magnet basically. And so further down, you can have if they want to become an instructor, so this is little elevated. You can also become, people also can become affiliate, and if they like the program, they can promote the program to others as being a partner, right? And if they, so what all services you're providing, right? So till then, here what we did, it was unaware. Now he became aware with the header. Then he became a researcher. He researched about the problem, what are the training programs you are giving. Then he started evaluation. So in evaluation, we told them the as an evaluator, we gave testimonials, video, and lead magnet, and about the author or the trainer, we gave them. So now at this point, now he's ready to take action and he wants to take the program. So either he can go back or he wants to discuss more about the particular program. Then he can get the support and call the platform people and get them more information here. And there are some frequent asked questions, whatever it is, how to enroll, how can I contact if there's a problem, when to access, is it online, what is operation times. So all these things can be discussed in more briefly here, and then come to the final. So you can just click to go to the top of the platform, and you have other icons and social media and all those things is further, but this is how the structure goes. So now I hope you got the entire flow of how we discuss. Let me jump back to our presentation. We just now looked into some live websites from the consultant point of view, a doctor's website, and we also looked in from a health coach or an academy based training platform website. So how the structure goes on very scientifically, very strategically, so that people can, or the consumers can take an action when they come to our platform. Okay, so this is what is the structure, and this is what we looked into. So now it's time. I hope you got more of clarity on how this entire structure is built. So I'm going to give you what template do we follow to build this content, right? So I'm going to give you this scientifically structured website content design template, where you have structured all the 15 sections in this particular template, which I'm going to give you for free. You can just click the link in the description and get this particular resource for free, where you can it's a Word document where you can now copy, where we already have the structure in place, headings, and what content as an example I have given. So you can just read the content and build your own content and make it as unique for you, so that now you can use that particular content to restructure your website. Or if you're looking to have your own website, and if you want us or our team to build that website, yes, there is a link below. Or if you're ready to build your own website, it's again very simple process. For that also, we have already built a lot of templates on how you can build your own website. So again, all scientifically designed structure. So you just have to fill the details as per the templates, and you'll be able to build your own website too. So it's your option. If you want to build your own website by yourself, yes, you can. We also have provided resources. You can do that. Not this, further down you can discuss, or in the previous video we have already discussed about this. And if you want our team to build an healthcare website, yes, we are specialized in this particular area, because as you can see, we have been doing this. As a doctor myself, I have been as a part of passion in the digital space. It's been more than now 15 years. I've been very much into digital space, and have built more than 100 websites till now, and been consistently learning and upgrading my skills. So with that, we can build again a wonderful website which actually can convert, and more details is very briefly also can be available, link in the description. Right, so further we also looked into today the entire 15 sections which has to be there on your website in a very strategical way, so you can have more traction. The more people can come to your website and actually take action on your website to get a solution from you, either offline or online. Right, so that's what we discussed. Hope you got great clarity, and I know it's something very new for you all. No one would have spoken about a strategy or a thought process on how the entire structure should go on a website. Right, so if that's been amazing, please click subscribe to our please like the video, and if you would like to have more content in the digital space, because now the digital health is going to be the way how the healthcare is going to be delivered. Right, so subscribe to our channel so you get more content on updated content on what we work on. Right, so with that, from this, what is strategy stage 1, unaware; stage 2, a researcher; stage 3, an evaluator; stage 4 is a purchaser who is going to take action. And that's what we discussed today in a very amazing way. Hope you got some more clarity here in understanding this. Right, if you are interested in this particular video, and if you want to know further what is next, yes, so the next video which you have to watch is about the design principles, which you're going to discuss how this entire what we discussed now is the design flow, how the flow has to happen strategically. And now we look into what are the principles behind to get this flow into a very nice looking, appealing content, so that people are visually happy about what you're put up on your website. And that's what is about designing principle of the website. And that's the next video which you're going to watch. Again, that will be in the link would be in the description below or here. Okay, so click it. So finally, again, thank you so much for being here. Please like and subscribe, and I'll see you in the next video. Till then, be active in the digital space. Thank you.